Hello and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. And I want to say a big thank you to all of you for your ongoing patronage, for your viewing. And we get a lot of feedback from many of you around the country, telling us some of the things that you would like us to talk about and things that are important to you, not just to doctors and healthcare professionals, but also to the lay people. And that's really why we started this show. The idea was that we wanted to empower you, primarily the layperson living in Kafanchan or Umuahia or somewhere, even in places where you don't have access to like a tertiary center like UCH or Luth or in Usuga, University of Nigeria, Usuga, where you can be informed about the things that you need to do to take care of your health, things you need to avoid, things you need to do, and also, quite just as important, know when to reach for medical attention to address an issue before it becomes too bad. And we know that many times we tend to not take enough care about our health, and we let things continue to grow and build and fester until it becomes a big problem. And so that's what we're trying to avoid with all these messages, with all these episodes. We're trying to look at health from every angle where the Black person or the African is concerned. And with that in mind, our guest today is going to help us do just that. I'm going to mention her name. She has been a mother, a friend, a mentor in many cases, a dear, 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 dear person to me. So I'm so happy to have her on our show today. So I'm going to say Dr. Toyin Okwesomi, popularly known as Dr. O, is the founder and CEO of Gennesaret Medical Center in Maryland, USA. She is also the founder of the nonprofit Global Vision Foundation. She's going to tell us a little bit about that. And she's also the hostess of Medical Mondays with Dr. O. Dr. O, welcome to the show, ma.
Thank you so very much. I am so honored. I appreciate you inviting me to the show. And everywhere you are in the world, how are you?
I'm sure there are people looking at you from all over the world too and say, hey, that's Dr. O. We know her because of your weekly shows, which as we would know is aired all over the world. People log in and they get a lot of value from your show. So tell us a little bit about what you do. And these are the three major areas I've talked about. I know it's a lot more than that, but let's hear about what you're doing in the world.
Okay. Thank you. Well, I'm a family practitioner first. So from babies to any age, I also treat HIV and I treat addictions. I love bridging or trying to bridge health disparities in our populations. And so we do this through a nonprofit organization, Global Vision Foundation, by doing health fairs all over the nation in the US, and also by doing medical missions to Nigeria, Kenya, and Ghana. So we do everything, take care of every part of the body, screening for high blood pressure, diabetes. We do BMIs, that's the body mass index, comparing the height to the weight and seeing where people falling and what adjustments need to be done. We check the eyes, do cataract surgeries, take care of the teeth, every part of the body we do on medical missions. And
so you carry teams, like you have teams that you bring all the way from the US to Nigeria and Ghana and the other places.
Yes, we take teams from here to whatever country we're going to, and then we liaise with teams on ground. So we work together synergistically to take care of patients.
Nice, fantastic, fantastic. And so obviously you have a heart. I mean, you left Nigeria many decades ago, but you still have the heart to keep coming back and giving back to your is it motherland now or fatherland now? I'm not sure which of them is it. Is it motherland or fatherland? Okay, all right. Aren't you going to correct me, Dr. O?
Motherland.
Help me, yeah. Save me from this embarrassment. Okay. So as we're talking off camera, and as you know, some of the things that are more African centric, some of the ailments that, I mean, they afflict everybody, but there are some that are particularly, shall we say, exaggerated or occur in much greater frequency among African Americans here, and of course, Africans and Nigerians, Black people in general, around the world. We know about cancer, prostate cancer, breast cancer, Black people. We know about kidney diseases, Black people, diabetes, hypertension, and a few other conditions, even dementia, which I talk about a lot. Black people seem to have it worse. So I know we can't talk about everything in this particular episode, but I, hypertension seems to stand out more than anything else, and it seems to be something we're very careless about. So, what do you say we start with hypertension and talk about that?
You're right on the money. I must say, though, that it seems like every disease entity becomes worse when it gets into the Black population. We saw that in HIV, but that's not the talk tonight. we need to do a lot of work in that area. But hypertension, we call it the disease of Black people. We also call it the silent killer. The silent killer, because most people that have hypertension, that's high blood pressure, don't even know they have it because there are usually no symptoms. They go about their daily work, daily activity, and they don't know they have anything. When people show up in clinic with headaches and chest pain, we get excited. I get excited that thank God, because blood pressure is 200 and something over 100 and something. And, they show up, they say they have this headache or this chest pain. I'm like, great, because now we can still do something about it before disaster happens. We can treat and, bring down the blood pressure and avert possible complications of high blood pressure. That includes heart attack, stroke, congestive heart failure, kidney failure, or blindness without any warning. These things happen without warning. And then, people say most of the time that it is spiritual. And God forbid that somebody fought with someone before then, and that person is in trouble. So high blood pressure is a big one. And how do one know that they have high blood pressure? It's just by checking. Again, it's a silent killer. Most people have no symptoms. So if you don't check, you don't know. And that's one of the reasons we do the health fairs, we do the medical missions, so that it gives people opportunities, at least, when we do that, for them to check.
Absolutely. And one more thing that you didn't mention, but I've started looking into it more and more is dementia. We know that untreated chronic hypertension can eventually lead to dementia by different mechanisms as well. So you're right on the money. Well, before we go in deeper into this, why do you think it is that you mentioned that when a condition gets into the Black community, it tends to be exaggerated, or it tends to be worse? So why do you think this is so?
It's actually not exaggerated. The exact word is it tends to be worse.
Tends to be worse.
Yes. And I don't think we have all the answers yet. I think, though, that one of the reasons, though, is because of late diagnosis. Most Black people, or let me say, a lot of Black people don't do those yearly checkups or follow up with disease entities, even when something is found. We tend to spiritualize things and decide that we want to use, natural products or treat it our own way. Oh my gosh, a lot of us just feel we know so much more than doctors, that, it takes time to explain in clinic sometimes the disease entity and what needs to be done. So I think that's one of the reasons. There may be more. I believe there are more that we need to still look into. And until we do more probing, that's one reason, not taking adequate care of ourselves.
And I think, if I may say this too, I think one of the other reasons too is that most medicine, modern medicine, is was developed from treating and researching the white person, specifically the white male, the white man. In fact, we're now getting a bigger call from female doctors who are saying that many of the drugs that have been used commonly today were studied on white men, not even white women, for various reasons, including the problems with keeping track of the monthly periods. So I understand, and I don't want to get in trouble here, but it seems as if there has been a narrow range of people who this thing has been, who the most treatments and most drugs have been developed for, that adapting it to a different demographic like the Black person, or even the white female, it doesn't fit as neatly into those boxes. And sometimes we're finding out the hard way. For instance, when it comes to hypertensive drugs that we're going to be talking about, there are some drugs that work perfectly for white people that can kill. And I've seen someone who actually died, but he was resuscitated from using the same antihypertensive that a white person would do very well with a white person, but did not do well for that Black person as well. So I don't know what your thoughts are where that is concerned.
Well, I haven't seen that, but I would say this to take us a little bit to the core of this and to focus on high blood pressure.
Yeah.
The researches that were done on high blood pressure in the past, yes, were done on white males. Why was that? Because Black people usually don't volunteer for researches.
Yeah.
For obvious reasons. They've had bad experience in the past.
Yeah.
So when we talk about, even the symptoms of heart attack, the symptoms that we talk about, the chest pain, the diaphoresis, the sweating profusely, possible nausea, headache, when somebody's having a heart attack, those are symptoms of the white man found in research. We've now seen with more Black people, women, more white people, more white women, Black women, Black men, volunteering for researches, that the symptoms are different, especially in women, whether Black or white. Women may present with just left-hand pain and they're having a heart attack. So when I worked in the ER, in the emergency room, and a woman presents with left-hand pain, we do EKG right away. And you know what? Sometimes they are having heart attack right there acutely. So fast forward, more of us are, participating in researches. And in recent times, talking about high blood pressure again, we found out that Black people do better on medications called calcium channel blockers and diuretics. So what are calcium channel blockers? Because for our audiences who know these things by name, and again, I'm in the US, hopefully I'll stick with the generic names like amlodipine, nifedipine, diltiazem, stuff like that. Black people do better on those. And on diuretics, spironolactone, hydrochlorothiazide, clothalidone, medications like that, than on some other medications that we used to use. But when we are treating high blood pressure, we do know that some medications like the ACE inhibitors, like your lisinoprils and benzopril, stuff like that, and the ARBs, angiotensin reductase blockers, they protect the kidneys. If somebody has diabetes, we want to put them on it. High blood pressure, we know they protect the kidneys, but they will not bring down the blood pressure of a Black person as much as we would like them to do. So what people like me do in clinic is combine them.
Mm.
We put them on the medication that will bring down the blood pressure very well, that we know that research has shown, and then the one that will protect the kidneys at the same time. It will still bring down the blood pressure some. It may not be as much, but it would work together to do the needful and do that protection. So I have not seen medication that is used in a Caucasian, in a white person, that kills a Black person. No, I've seen medications that Black people may have more adverse reaction to. There are some HIV drugs like that. There's a particular one, that would increase the risk of kidney problems in the Black person more than in the white person. And we saw that, treating HIV when HIV was still really, really difficult to treat, that we saw that, obviously, without even doing overt research on that. But yes, you are right. It is important that we participate in researches so that medications that would work better for us will be known. But without these researches, it'll be tough.
Yes, and like you said, you mentioned in passing that it's a problem in the U.S., especially because of the history of abuse and being taken advantage of over here. Blacks are generally very hesitant or very reluctant to go ahead and be part of research. Part of it, obviously, too, is economic reasons or accessibility reasons. Sometimes a long distance to travel to go to.
Actually, not in the US, not economic reasons, because people get paid to participate in research. It is trust.
Okay.
It is trust. I don't know if you know about the syphilis.
Yes, the Tuskegee.
So I don't want to I don't want to bring that up here, but it is about trust. With more of us being in medicine and being able to give, some confidence, assurance, explain exactly what research is, because when you participate in research, you may not tolerate the medication, which is part of the research is done. We want to see how many people tolerate this medication, how it works in them, and kind of possible adverse effects they can have. All of those things are what we look at in research. And because we're able now to articulate them, to explain them to people of color, and help them understand that these things can happen, but unless you participate, unless you take it, you don't know. But nobody is targeting anybody to hurt them. We get that message across, and we've seen some increase in participation. People do get paid.
Oh, fantastic. Fantastic. Well, I also wanted to mention too, if you're watching this program and in the US or you're part of a pharmaceutical research company or whatever it is, and you want to do research in Nigeria, which has, most people don't know this, which is shocking. Nigeria has the most number of Black people in a country on the planet. And so if you want to really get into research and to know how the Black physiology or the Black person's anatomy or biochemistry works, come over to Nigeria and we will help connect you with the population that you need to study. Anyway, that's just by the way. Doc, let's talk about, since we're talking about heart disease and hypertension, there's something that many people do, which I find very troubling, and many times they do it because they think they're helping themselves. Meanwhile, they're hurting themselves, and that is taking calcium supplements. I know we discussed this off camera before. What are your thoughts about taking calcium as a supplement in addition to whatever else they're doing, especially Black people?
Thank you for that. I discourage it. It discourages it. our nephrologists are begging that we don't do it.
Okay.
So if you don't have low calcium for whatever reason, there's no reason to take the supplements.
Okay. But people
Especially
think, they say that they need stronger bones and they're afraid of osteoporosis and things like that, especially women.
if okay, they're thinking wrong, because too much calcium, or when one takes calcium, we take calcium supplements and you have too much calcium, you can actually, hurt yourself. You can destroy your kidneys. Chronic kidney disease, kidney failure, anywhere in the world, especially in Africa, is just not a good thing. Dialysis is not cheap. And especially for people who have chronic kidney disease, and in our population in African countries where people don't, do regular testings and stuff like that. Some people don't even know they have chronic kidney disease until it is too late. Taking calcium would be problematic.
Can you explain how and why that is so?
Okay, so this will get a lot complicated because
okay, that's the thumbnail version.
in chronic kidney disease with increased phosphorus, that itself binds to calcium. Also, vitamin D cannot be converted into the active form. You talk a lot about vitamin D, and we know the importance of vitamin D. When we take vitamin D, it is the active form that actually does the work it does in the body.
Mm-hmm.
The vitamin D you take gets converted to the active form. And the calcium itself needs this vitamin D to strengthen that bone you're talking about.
Mm-hmm.
So when you hinder that, that is a problem in itself. And low vitamin D can cause increase in blood pressure, can actually cause hypertension when the vitamin D is low. So it's better to take dietary calcium rather than taking the supplementation. The green leafy plants like your the vegetables are rich in calcium. Some fishes are rich in calcium, like sardines, salmon, mackerel are rich in calcium. They're also rich in vitamin D. Things like flaxseed, almond nuts, even Brazilian nuts. But if you're going to eat Brazilian nuts, please, one a day. I've had bad experience with that.
We don't have much of those things. Those are very exotic things now, Doc. We don't have those in Nigeria.
What about okra?
Okra.
Okra is rich, yeah, in the greens, the leafy vegetables. Yeah, those things are calcium.
So it's always better to take it as part of the whole food, as part of the whole food matrix, for sure.
Let me tell you another thing that excess calcium would do. It increases colonic polyps.
Really?
Yes.
So those little growths in the colon that can lead to colon cancer, is that what you're saying?
Can lead to colon cancer eventually. It does. It increases kidney stones, which are, the like masses of stones, in the kidneys, and they're not comfortable, to say the least. They're very painful.
It can cause a lot of pain. But how about some doctors believe that taking calcium supplements can actually cause the calcium to is it precipitate in the blood vessels, the walls of the blood vessels, and be part of the problem, causing blockages, especially in the smaller vessels. What was your experience?
that it causes vascular disease also. I told you that I have to be careful because this gets very technical explaining it.
Yeah, of
Vascular
course.
problem. You're right about that. And it also increases creatinine. Creatinine is one of the things we look at when we examining kidney function in a person, and it also increases it. So I don't I don't recommend calcium supplementation unless somebody has low calcium for whatever reason, and the reason needs to be investigated. And except for that, it is not a necessary supplement to take.
Yes, I agree. If a person has low calcium, maybe even giving calcium supplements alone is not the solution, because the calcium has to be driven into the bones and the teeth where it is used. And so sometimes people are also low in other things like that help to do that, like vitamin K2, magnesium too is very important.
Vitamin D.
Vitamin D, exactly. These are all part of the whole symphony, the whole orchestra that help to make sure that calcium gets into the bones and teeth and stays there, rather than leaching out due to whatever condition, maybe acidosis or metabolic syndrome or whatever. I know we're getting a little bit technical now. But calcium as a supplement, I isolated calcium as a supplement, except if you are actively, rigorously exercising, like maybe you are an Olympic athlete, the Olympics is coming up next month, or you're training heavily, you're lifting weights, that's when you can be deficient in calcium. But for the average person on the streets, most of us, especially Black people, we're not deficient in calcium when it comes to the bones. That's why calcium channel blockers work so well for us, because theoretically, because calcium deficiency is not a common thing in Black people. It's the complete opposites. That's, again, calcium channel blockers work against calcium to bring the blood pressure down, and it works so well for us as opposed to the white people. So I think, Doc, I think we really need to be shouting this from the rooftop, so that Black people should not be taking calcium supplements.
No, we should not be taking calcium supplements. But if I may, I want to say though that prevention is very important. So, like we're talking about high blood pressure, I just want to mention some things about food. I believe, and because of what I've seen in what we're taking makes us. The body does not forgive. What you put into the body is going to give out. That's what it is. So decreasing salt intake in the food is very important. So once food is cooked, don't add additional salt. And if you are cooking, go easy on the salt. Decreasing dairy products. I don't think that's a big problem though in the African community, except those that are in the diaspora, meaning, dairy products, cheeses, and stuff like that. We need to decrease that. Increasing fruits and vegetables.
Is there any reason why? Can you explain quickly why that's a problem?
Because, dairy products, salt increases blood pressure.
Dairy products too?
Yes, increases blood pressure. So if you're going to drink your milk, I say this sometimes, that think about it. We are in the animal kingdom, right? Human beings are in the animal kingdom. All animals, when they have their babies, they breastfeed. But it comes time that they wean the babies of the breast milk, and the babies, the children, or the babies and children start now eating what that animal is eating in the habitat, right? Human beings are the only ones, we are the only ones who continue to drink milk after we're weaned. Then we don't drink milk in our species. We drink milk across species. We drink cow milk, goat milk, what have you milk. And so And then we start having lactose intolerance and
which is worse among Black people, by the way. But I'm
so,
still a little.
but we see that it also
Go ahead.
increases blood pressure.
Yeah, how does that happen though? I've never heard that before though.
You've never heard that you should decrease dairy products if
That,
you
da-
high
that
blood pressure.
dairy products cause blood pressure, high blood pressure.
It increases high blood pressure. Yes. And
How?
well,
Without being too technical.
without being too technical, what is the cheeses, the milk, and the lads?
Butter.
So what does lard do in the vessels?
Okay, you're talking about the fat?
Yes, they are fats, and they're not
Okay.
friends of your vessels. So anything that will clog the vessels or that will slow the flow of blood in there would increase blood pressure because it would increase pressure.
Okay. So it's more of a fat problem than anything else. So okay, so we're looking at a couple of things.
That being said, if I can just finish this train of thought before I forget, increasing fruits and vegetables and increasing exercise brings down blood pressure. So I talked about things that can increase the blood pressure, and I want to talk about things that would bring it down,
Okay.
in our habits and eating.
I think that's a great holistic way to look at it. More exercise, although we've known this from the beginning of time, actually, Dr. O, that we have to exercise more, we have to take more fruits and vegetables. And so we all know it's just that it's always a challenge to apply it. And of course, we don't, especially when we turn 50 and above, we don't really like all this exercise that much. And so that's part of our culture that we have to address, right? Maybe just let's start with this. Viewers, please listen. Let's start with this. One of the things that you probably can be very helpful is maybe after a meal, rather than just going to slump in front on the couch and watching TV or your favorite show. Take 10 to 15 minutes to walk around, maybe your neighborhood or your compound. And that helps to, what that does is that it helps to drive down your glucose levels, also helps to drive down the insulin levels because your muscles are working. So your muscles are taking in more of this glucose and insulin. And also it will help to calm things down and strengthen your muscles as well. That's probably one thing that one would recommend. Another thing I also try to tell people is the importance of sleep for cardiovascular health. If you don't have good quality when I say 7 to 8 hours, sometimes people laugh at me, especially when I'm talking to my former colleagues in the military. They're like, who do you think you're kidding? They laugh at you. But maybe whether it's 5 hours or 6 hours or even 7 hours, make it count. And I always emphasize, turn off the lights, make sure you sleep in a dark room. If you can reduce the temperature, sleep in AC. It's hot in this part of the country and this part of the world. Try to reduce the temperature, and I always recommend people sleep with a face mask. I always sleep with my face mask. I'm not talking about the mask that we use during COVID-19, but something like this that basically covers the eyes, so it gives the impression that it's dark. That helps you have better quality deep sleep. Anything you want to add to that, Doc?
You're right on the money. Sleep is important.
Yeah.
And actually, research has shown that the brain washes itself out in sleep.
Yes.
So when you talk about sleep, when you talk about exercise, they would apart from everything else they do, they also help with the brain health. So I agree with you. We need to have good sleep, although research for that showed that the 7 to 8 hours that we used to talk about may not necessarily be true.
Oh, really?
Has different sleep needs. So some people do well on 4 hours of sleep. Some do well on 10 hours of sleep. some on 8 hours of sleep. Consistency is very important. So if you go to at 10 and you wake up at 6, you want to make that consistent. Consistency is very important. It's something else that was shown in research.
I see. That's a good point. Thank you for that, Dr. O. All right, looks like our time is fast spent. Dr. O, thank you so much for all you do, for taking time out to speak to us today, and we hope we can have you back soon.
Thank you so much. I appreciate you, and thank you all. Enjoy and stay safe.
Yes, stay safe. All right, folks, thank you so much for joining us. Remember, you can watch reruns. You can watch these archived videos on our website, brainandbodyfoundation.org. And you can follow me and the foundation, and DL David Ajibade on all social media platforms, and Brain and Body Foundation on all social media platforms. Reach out to us and tell us what you think should be the next episode of an issue that you feel we need to discuss on this show. We are here for you. And remember, your health is in your hands. Stay strong. God bless. Take care. Bye.
Bye.